Good afternoon, everyone, and welcome to this noon meeting, which is hosted by the Center for Environmental and Occupational Health Research. So today we will be having Mandy, who will be speaking to us about her research on the association between sex hormones and asthma in young boys. Just a little bit of background for Mandy. Mandy is an upcoming environmental health scientist. She completed her master's in public health in the environmental health track at UCT. And she previously worked as an intern for the African Climate and Development Initiative at UCT and has also been involved in the strategic approach to international chemicals management. A project which was done under the Environmental Health Division. Mandy's primary interest is really in the application of advanced statistical methods in environmental health sciences. So over to you, Mandy. Mandy, you can, yeah. Mandy?
Yes. Thank you so much, Prof.
Good. Okay.
So I think I'll share my screen now.
Okay.
Is that okay?
Yes, perfect. Thank you.
You can see my screen, right?
Yes.
Okay, thank you. Thank you so much, Prof, for the introduction. So as Prof has mentioned, I'll be presenting on the research on the relationship between reproductive hormones and asthma-related outcomes in boys residing in rural Western Cape. So childhood asthma is a global public health problem, and its prevalence is increasing in South Africa, both in rural and urban settings. It is known to be one of the common reasons of children absenteeism at school because of hospitalization. And previous studies have shown that there are sex differences in asthma prevalence among children, and that these differences change over time. Asthma has been seen to be more prevalent and severe in boys, but this sex difference, there's a shift in the sex difference with women having more severe and more prevalent asthma outcomes than men after puberty. And research has shown that these sex differences may be partly explained by changes in levels of reproductive hormones during the lifetime. And however, there are limited epidemiological studies on the association. And those that are there, they focus on mostly adults and in high income settings. So this study sought to describe the prevalence of asthma-related outcomes among boys, and also to assess the association between asthma-related outcomes and reproductive hormones. To do this, we used data from a cohort study that was conducted among 1,000 school-going children from the rural Western Cape. On the right, it's a diagram of a summary of the data collection process that happened during this main study. But for this current sub-study, it will be a cross-sectional analysis of the data collected from boys aged 6 to 18. And these will be people that participated in the baseline study in 2017. So our data collection was in form of interviews with parental interviews, collecting data on collecting demographic data and also asthma symptoms using the ISAC abbreviated questionnaire. And this is where our outcomes came from. We had parental reported asthma, and we also had current wheezing, and finally we had asthma symptom score greater or equal to 2. There were also child interviews where we got most of our additional demographic data. Blood samples were also taken to the labs to test for LH, FSH, or estradiol, and testosterone. These were our hormones. Physical examinations were also done for anthropometric measurements such as height and weight. Okay, so for our statistical analysis, first we presented descriptive statistics. These were for social demographic characteristics and asthma risk, and we also had one for reproductive hormones and SHBG, and another one for asthma-related outcomes. Second, to select potential confounders, we fitted a series of bivariate logistic regression models between asthma outcomes and the covariates. And thirdly, we assessed the association between each outcome and the reproductive hormones by fitting an unadjusted logistic regression and 2 multivariate logistic regressions, which were adjusted for different covariates. The first multivariate model, which we named Model A, was adjusted for co-founders that we had a significant outcome, whilst the second multivariate model was adjusted for all the covariates that were in Model A and other co-founders, a priori co-founders, such as BMI and current smoking. And lastly, we did a concentration response curves, which were used to describe the association between log transformed sex hormone levels and asthma-related outcomes. From the 473 boys enrolled in the main study, a total of 314 boys aged between 6 to 18 with complete asthma outcome and hormone level data were included in this current study. And they had a mean age of 11.2 years. So what we found is more than half of the participants had low birth weight, and 73% reported a family history of allergy. So we had stratified our data into age groups, or into 3 different age groups: age 6 to 10 years, age 11 to 14 years, and age 15 to 18. And from that, about a quarter of the boys in the older age group were current smokers. And the mean hormone levels were increasing across all the age group categories for all the hormones, except for SHBG, it was decreasing. So to assess the asthma-related outcomes reported in the past year, we also assessed this using proportions. This is where we got this is where our outcomes, we have our proportions for our outcomes, with current wheeze being 6.1% and the asthma symptom score being 6.7, and parental reported asthma being 8%. So for asthma symptom score, it was derived from the sum of positive responses to the marked variables on the table presented. So we also looked at the association between host characteristics and asthma-related outcomes in an unadjusted logistic regression model. And just to mention a few findings from that, is we found that maternal smoking during pregnancy and exposure to environmental tobacco smoke in the home were positively associated with current wheeze and asthma symptom score greater or equal to 2, while living on a farm was associated with reduced odds of parental reported asthma. So we also looked at the relationship between reproductive hormones and asthma-related outcomes. Here, I only presented the final model. I previously explained how we had an unadjusted model and then two multivariate adjusted models. So here I only presented our final, the second model, the final model. So from this, in general, we found that both total and free testosterone levels were negatively associated with current wheeze and asthma symptom score, and also parental reported asthma. And in other words, boys with increasing testosterone levels were less likely to report asthma-related outcomes after accounting for important underlying risk factors. Similar associations were also found for LH and FSH, but there were no clear associations for estradiol and SHBG with asthma-related outcomes. The concentration response curves that you see on the screen further demonstrated that relatively high levels of testosterone were associated with reduced odds of all the three asthma-related outcomes. So for summary findings, this current study found that total and free testosterone were associated with reduced odds of having any of the three asthma-related outcomes after adjusting for important underlying risk factors. And this finding suggests that testosterone has a protective effect against asthma in boys. Weaker evidence suggests a negative association with asthma-related outcomes and FSH and LH, and no evidence was present for estradiol and SHBG. So this study had some limitations, and some of them are that hormone concentrations were only available for boys. So that's why the study was focusing on boys, which limited the exploration of association common in both males and females, or boys and girls. And the study also used outcomes based on questionnaire data only, and did not include additional objective measures of lung function and inflammation. However, further studies could be done, for example, longitudinal studies to investigate the relationship between endocrine functions, which involves the disruption caused by environmental factors such as pesticides, and asthma-related outcomes. Further studies can also incorporate additional objective measures of asthma, for further to further understand these associations. So in conclusion, this work makes an important contribution to our understanding and of the mechanisms of asthma, particularly in children. Thank you. I hope I wasn't my tongue. I wasn't too fast. I was trying to be cautious of time.
Thank you, Mandy. Thank you very much. You can stop sharing. There we go. Thanks so much. Thank you for that wonderful presentation and well done to you. Do we have questions for Mandy before I ask some questions? Anyone? Okay, while we're waiting for any questions, why do you think you saw no association between the female sex hormones estrogen and asthma-related outcomes? Mandy?
Oh, sorry, I was muted. Okay. I think this was because most like the boys that participated in our study were young, and therefore we could not detect the estrogen. So maybe for older boys, the estrogen will be a bit more detectable, and further studies can be done on that. But for our study, the boys were quite young and estrogen couldn't be like detected. I think it was something like 18% of like our sample that like had estrogen that was detectable.
Okay, thanks for that. Any other questions? And Mandy, what do you think of the study design in answering the question? Are there any limitations that may be posed by the study design? What kind of study was this?
This was a cross-sectional study.
Okay, so what do you think about that? Is that a limitation and why?
I guess, yes. That is why in the recommendations I had suggested a longitudinal study could be done, maybe to see how, like, as the boys grow, or the study participants, whether it's males or female, as they grow, how these hormones change and how these affect their asthma outcomes. So a longitudinal study would be quite interesting to see like what they will get. So yeah.
Okay, because you can't assess temporal responses, you don't know which came first, right? In the current study design.
Yes.
Any other questions? Okay, while we're waiting, I have another question. How about what do you think, what implications does this have for studies of older women and hormone levels? And in terms of treatment or management of older women with asthma using hormonal therapy? Mandy?
Oh, yes. I think from like the findings that we found, the major finding that we found is that testosterone can possibly have a protective effect against asthma related outcomes. So maybe for treatment in older women, it could be a possible avenue for treatment, like asthma. Testosterone could be a possible avenue for treatment in other age groups or in other sex groups. But it will be interesting to see the same study being done in older women, and like the application of this being done in older women. But yeah, I think it could have intervention or treatment possibilities there.
Good. Did you come across any studies in your literature review on this aspect?
I think one or two. There isn't much research on this, but yes, I think I came across one or two that focused on like older people, and the effects of testosterone and how it affects asthma outcomes. So yeah, I did come across a few.
And in terms of treatment, were there any studies that looked at this modality as a hormone replacement therapy or anything in relation to management of asthma?
Mostly they were suggesting, as I am.
Okay.
They're suggesting that it could be an intervention or treatment avenue, but I don't think I recall meeting one that was like definite on exploring this.
Right.
Yes.
Okay. I'm not seeing anything so far. Then I'm going to ask you a last question, unless there are others. So if you had all the resources in the world, and if you had to do the study again, how would you design a study?
I would definitely include both boys and girls in the study. Because like in general in the world, girls tend to be there are few studies that focus on women and girls. They are there, but we are not really represented. So it will be interesting to include them in the study. And also have maybe a bigger sample size than what we had. And again, maybe do do it as a longitudinal study to test for temporality and also see how the participants progress with time. So yeah, I think that's it.
And perhaps use more objective measures. I think you did mention this.
Yes,
Spirometry.
definitely. Yes.
Yeah.
Yes,
Right.
definitely.
Okay, thanks. Thank you. I don't have any other questions. Akil, as co-supervisor, did you want to ask Mandy any questions?
Sorry, I missed. I just joined. We are
Okay.
busy with the exam, so
Right.
I haven't seen her presentation.
Okay.
But
Yeah.
obviously, I have received just recently, so I presume everything went nicely. So I don't have any additional question from what we had during our supervision session.
Okay.
I presume everything went off nicely.
Okay, Akil, while you're on the floor, could you say something about endocrine disruption and sex hormones and asthma?
Yeah, so basically, pesticides, especially pesticides in general, has been associated with asthma-related outcomes. As you know, we've done studies on that, and then basically, in terms of endocrine disrupting, in terms of sex hormones, as Mandy has indicated, there's a possibility that there's evidence now that the sex hormones can interfere with the with asthma, reducing asthma outcomes, especially testosterone. So obviously that this will have an impact on the effect of pesticides on asthma outcomes. So either pesticides can have an effect on asthma and also interfere with the association between pesticides and asthma, either by interfering basically pesticides themselves can interfere with asthma directly, or otherwise with indirectly through the reproductive hormones. So obviously, in investigation, looking at the relation between asthma and asthma outcomes, one needs to either probably look at effect modification. If you're looking at whether pesticides have an effect on and see how this might be modified by reproductive hormones. So that's basically the way one would look at it. Then to look at effect modification through reproductive hormones by pesticides. So in other words, a pesticide exposure, the effect could be different, at different, depending on the levels of hormones that that are prevalent in the among the participants.
Right. Okay, great. Thanks for that. So watch this space. I'm sure the other studies will look at some of these aspects, and I'm sure at some point we will present some more data on this particular aspect. So I'm looking at the chat. I don't see any other questions, and unless anyone wants to ask any question, that would be all for now. Thank you so much, Mandy, again, for making yourself available to present your research and to share it with others. And thank you all for making the time to come and listen to her presentation and to gain better insights into this particular aspect. Thanks so much. Have a good day. Bye, everyone.
Thank you so much. Bye, everyone.
Bye.
Bye.
Bye. Bye.